This is Treva Jones with the axial skeleton video. The axial skeleton is the portion of the skeleton that provides the structure and support. So, this is the frontal, parietal, occipital, and the temporal. The external occipital protuberance is this bump here, and that houses the trapezius muscle, which supports the back of the neck. Something happened to my skeleton's arm here. Temporal mandibular joint is the joint that connects the mandible and the temporal bone. The mastoid process is this here. The styloid process, it's hard to see here. I guess you can see that little bone there. The external acoustic meatus, and that is actually that little notch there. The squamous part of the temporal bone is here. The petrous part of the temporal bone inside, actually here, and the internal auditory organs are housed in there. The internal acoustic meatus provides a passageway for facial and vestibulocochlear nerves. So they pass through there. Head back on here, so we'll get it together. The superior orbital fissure, you can see it's right in there. The greater wing and lesser wing are actually here. The optic canal, right in there, and the optic and cranial nerves pass through there. So the nerves that go to the brain and to the eyes go ahead and pass through the optic canal. In the sella trucia, the sutures, the structure that sits in this is the pituitary glands. The ethmoid is actually sit there. And the ethmoid is actually on the inside of the eye, the orbit, next to the nasal bone there, on that portion. And it houses the olfactory bulbs, and the cribriform plate is what supports those olfactory bulbs in there. So we're going to the sutures. The coronial suture is actually this suture here. The sagittal suture, and that is the suture that goes from front to back. Back from the frontal bone to the occipital. The labnoid suture is the one that goes this way here across the back of the head. And the squamous suture, that's what you see here on the side. There. Okay, so facial bones. The first one that we are going to be looking at is the maxilla. So that is the upper portion of the jaw here. The nasal bone is there. The zygomatic, that's actually, I guess you would call it the cheekbone there. The vomer, which is kind of like on the inside, right on the tip, I guess you would say, of the nasal cavity there. And the vomer and the ethmoid are the two bony portions of the nasal septum. And the squamous and the zygomatic process is what I guess you would say creates the zygomatic bone. The mandible is, I would say, the bottom jaw, the body of it. The ramus, which is actually this here, the angle, the mandibular condyle, which is here, the notch, which is kind of what protrudes out here. The vertebral column, I can actually turn him around here. The cervical vertebrae, there's 7, would be from the axis down to the 7th here. The atlas, that would be number 1 of the cervical. It's C1 or the atlas. And then the axis is the C2, the second one. So this allows you to nod here. Let's see. What's unique about this is that the vertebral arteries are allowed to pass through here to service the brain. The thoracic vertebrae, there are 12, and that's, I guess you would say, the middle of the back there. The intervertebral foramen, it bears facets for the ribs. Let's see. The lumbar vertebrae would be here, and there's 5 of those. And then the sacrum here, and there's 5 there. Go to the sternum. So this would be the jugular notch. This would be the body. The xiphoid process would be that. I guess you could see the line there. And then the ribs. The true ribs would be 1 through 8, or sorry, 1 through 7. 8 through 12 would be false ribs, and then these 2 down here would be floating ribs. And this is my axial skeleton video.